We're continuing on with Unit 1, and our focus will be on laboratory safety. Safety in the urinalysis laboratory is no different than safety in the laboratory overall. It includes practices to prevent the spread of infection and to ensure patient and employee safety. And this is important because laboratory employees are exposed on a daily basis to a number of biological, chemical, and potentially electrical hazards such as fires. The Occupational Health and Safety Act of 1970 was established to provide formal regulation of health and safety for all employees. Prior to this, employees were working with potentially hazardous chemicals or reagents. They were not told of the hazards. They were not trained on how to handle these dangerous chemicals, and many of them became sick and some of them died. So this is administered by the Occupational Safety and Health Administration, OSHA. Be very familiar with that acronym. And this requires employers to educate their employees about potential workplace hazards. For example, when you were training in phlebotomy, you were trained with all the risks that are associated with performing phlebotomy, such as a needle stick. The employer must provide personal protective equipment at no cost to the employee. If you have special needs, for example, you wear an extra small size glove, the employer must provide that size glove to you. They cannot say, well, just work with what we have, because that would be unsafe. You will be taught over and over and refreshed on a regular basis on how to deal with biological hazards. There are two levels of precautions that are followed in healthcare. The first is standard precautions. These are infection practices that are applied to all patients in all healthcare settings, regardless of their diagnosis. Standard precautions usually mandates the use of gloves. Transmission-based precautions are the second level, and these are used along with standard precautions for select patient populations who have been identified and diagnosed with contagious diseases or conditions. I want you to remember all body fluids, secretions, excretions, except sweat, are considered potentially infectious and capable of disease transmission. Transmission-based precautions apply to specific patients with known or suspected infections. And there's three categories. There's contact precautions. These are utilized when a patient has open wounds or infected wounds. There's droplet precautions. These are drops that are expelled when we cough or we're speaking. The drops, I want you to memorize this, are greater than 5 micrometers. Because of the larger size, once they leave your mouth, they fall quickly from the air. They do not remain suspended. And then airborne precautions. I want you to remember these are drops that are less than 5 micrometers. They're very teeny tiny. And because of that, they have the ability to remain suspended in the air and waft or float around to where people entering their room and breathing in could potentially inhale infectious agents. So those are the three types of categories of precautions. I want you to know there's 3 routes of infection or disease transmission. We talked about inhalation, where we actually breathe in the organism and then become infected. There's ingestion. Frequently we hear on the news about bagged salads being contaminated with an organism that causes a severe gastrointestinal disturbance. And then there's direct inoculation or skin contact. This is why we always encourage you that if you have a wound, that you cover it with a Band-Aid, even though you're wearing your gloves, because we don't want the contact of, let's say, a urine that has an infectious agent. Or in your field of work, phlebotomy. The most hazardous component of phlebotomy is that needle, and the potential that you may stick yourself with a dirty needle and inoculate yourself with contaminated blood. Appropriate personal protective equipment, PPE, is required when handling body fluids or any biological type of sample. You may be required to wear gloves. There are certain times that in addition to gloves, you may have to wear a mask. You should always have a laboratory coat on, and it needs to be buttoned from top to bottom. I've gone in the laboratory many times and seen techs with the lab coats open. How is that going to protect you if a urine spills or a tube of blood breaks and splatters everywhere. So be sure that is buttoned from top to bottom. Face shields may be necessary as you unstopper samples because there may be splattering. So all of these are the most common type of personal protective equipment that are used in the clinical laboratory. All specimens must be handled as if they are infectious and disposed of properly. This will be found in your SOP. There are certain sinks that are designated dirty sinks that you pour samples down, such as urine. These cannot be used for hand washing, and so they have to be clearly identified. Contaminated sharps, needles, glass slides, and broken glass must be disposed of in a puncture-resistant container that is labeled with the biohazard symbol. Then these are either incinerated or autoclaved. Most laboratories will contract with a company who will on a regular basis come by and pick up our biohazardous waste and dispose of it appropriately. Laboratory surfaces and equipment must be decontaminated daily with 10% bleach or some other phenolic disinfectant. This should be done before you start work, and this should be done when you are completing work. The OSHA rule of January 1990 requires every facility to have a chemical hygiene plan, and this plan will define the policies and procedures for handling all types of hazardous chemicals that you may be expected to work with. This requires educating personnel annually about chemical safety policies and their procedures. And I get so weary and viewing the same type of materials over and over. And so your employer may try to buy a different type of program for you to review. But again, on an annual basis, all employees must have documented continuing education in chemical safety. The components of a chemical hygiene plan includes proper labeling of the chemicals, the laboratory safety manual that may list the hazardous chemicals that you may be using in a certain type of analysis, what type of personal protective equipment is required when using this chemical, and safety equipment must be present, such as an eye wash and shower. And you must be educated on how to use the eye wash and how to operate the emergency shower. Because we had a student who was very, very short, and she couldn't reach the emergency shower handle. So we had to come up with a plan so that in the case she was exposed, she would be able to reach the handle. The OSHA Hazardous Communication Rule ensures that all employees are aware of the potential chemical hazards in the workplace, and this is known as the employee right to know. As I told you in a previous slide, back in the day, employers were not required to train employees about the hazardous chemicals they were working with. So this rule requires chemical manufacturers and suppliers to provide what's called a safety data sheet for every chemical that's utilized. And the employers have to make these available to the employees. Every laboratory section will have an SDS notebook where all the chemicals SDS sheets are stored. So for example, if you do have an exposure, you will have a colleague go look up that particular chemical in the SDS notebook so that you know the appropriate first aid to take. So these sheets include complete hazard and safety information about the specific chemicals. If you recall in the intro course, I had you look up the SDS sheet for water. Yes, there is a safety data sheet for water. To create a visual so that you can immediately know what the hazards are for the chemicals that you utilize on a daily basis, the National Fire Prevention Association created the Safety Diamond. And this list, there's 4 components to it. They're different colors, and you need to know what each color represents. The hazards are listed from 0 being not hazardous to 4 being extremely hazardous. We have the health, the flammability, the reactivity. The white section is always for special types of hazards that may be associated with this particular chemical. And it's always interesting, go under your cabinet at home and look at some of the chemicals that you have under there. A lot of them will have the naphtha diamond on them. It's very important that you know what to do when there is a chemical spill or you need to dispose of certain types of chemicals that you've used. So in the event of a spill, you want to consult the safety data sheet to determine the appropriate action. There are chemical spills available and accessible in the laboratory, some for acidic compounds, others are for alkaline compounds. Be sure you know which kit to use. If you are exposed, know the post-emergency treatment procedures for splashes and spill injuries. If it's in the eyes, you will immediately go to the eye wash station. If it's on your clothing, modesty goes out the window, especially if it's a very caustic material, and you remove clothing and go stand under the safety shower. How long do you have to do the eye wash or the safety shower? 15 minutes minimum, and somebody needs to be timing. A colleague needs to be timing for you. If chemicals need to be disposed of, be sure that they are disposed of properly according to the laboratory safety policies and applicable local, state, and federal laws. And let's say that you're cleaning house and you come upon a chemical that really looks old, or maybe it expired in 1990. It's not your decision to determine that it's okay to pour that down the sink. You need to find out from the manufacturer's SDS sheet how to properly dispose of that chemical. There are additional hazards that may be present in the laboratory, and the policies and procedures should be available to address these hazards. For example, flammable substances and fires. We store certain chemicals in vented, flammable storage cabinets. Usually if you go into a lab, you'll see these are really big and yellow, and they will have the hazard symbol on them. Compressed gas tanks. The tanks must be secured at all times in use and when in transit. If these caps get knocked off, they become torpedoes. There's gas under pressure in these tanks, and it can be very, very dangerous. So when you go into a laboratory and certain types of gases are used, you will see them chained to the wall. The valve caps must be in place at all times except when in use. So when we change out our canisters, we have to always put that cap on, so if the canister does fall over and there's no way the valve can be broken off. Electrical hazards. You want to monitor maintenance of your equipment. Periodically look at the cords that are plugged into the wall to make sure that they're not frayed or need other types of maintenance. When you are first oriented to your position, all personnel will be shown and made aware of the location and operation of all the safety equipment that is available in the clinical laboratory. This includes fire extinguishers, alarm stations, where if a fire is present, there's a pull that you can pull to alert the fire department, emergency showers, and eye wash stations. All personnel need to be aware of exits and evacuation routes and procedures to follow during emergencies. Do not wait until the emergency happens. Find that map. Find the safest way to exit. In the student laboratory, your instructor will show you the best and safest way to exit out of the student lab. Present your questions to your instructor at the beginning of class so those can be used for the guided discussion.